Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Garland.
Hey everyone, we're here today talking about gravity in the gut, a new hypothesis of irritable bowel syndrome. So this new theory suggests that IBS, the most common GI disorder, may be caused by gravity. The hypothesis was recently published in the American Journal of Gastroenterology and describes how the intestines, spine, heart, nerves, and brain evolved to manage gravity. Now, our guest and the author of this really interesting article is Dr. Brennan Spiegel, who's Director of Health Services Research at Cedars-Sinai, and he's going to be explaining that IBS and many other conditions could result from the body's inability to manage gravity. Welcome, Dr. Spiegel. So happy to have you here today.
Thanks so much for having me. I look forward to discussing this.
Yeah. So, let's just get right into this. When you first told me about this at ACG and you said it was coming out, I was so interested in reading it and it finally came out. So just tell us a little bit about your hypothesis.
Yeah. On the face of it, it might sound a little bit unusual. In fact, I thought it was pretty unusual when I first thought of it, to the point where before I even published it, I sent it around to a number of my colleagues to make sure I hadn't gone totally nuts. And to my surprise, they read the paper and said, oh, you know what? This kind of does make some sense. And some said even more than that. Just to take a step back, I haven't been spending a lot of time thinking about gravity at all. I've been thinking a lot about IBS for 20 years and studying it and taking care of people with IBS. And one thing that's always been perplexing to me is how a condition that affects roughly 10% of the world's population is still unknown in terms of exactly what causes it. And more than that there are so many different theories that are on the face of it seem really almost at odds with one another. So on the one hand, there's the theory that this is caused by bacteria in the gut. Good evidence to support that. There's other people that indicate it's really a problem with the way the brain processes pain in the belly. Good evidence for that. Or that's a problem with serotonin levels. Good evidence for that too. Or that it's really a problem with the autonomic nervous system. And we see a lot of overlap with conditions like POTS, for example. And you know what? There's good evidence for that also. And I thought, how can these all be simultaneously true? If I dig underneath each of those hypotheses or theories, is there some unifying factor? And when I did this exercise, I came to this kind of surprising conclusion that, well, gravity is kind of under it all. So the idea here is our relationship to gravity is not unlike a fish's relationship to water. Fish has evolved to survive and thrive in water. Its body is perfectly designed for that purpose. So that design is a controversial word in evolution. But it doesn't really think about the water, I assume. I don't know what a fish thinks about. It's just moving around in water. Well, we're like that too. Every fiber in our body evolved in some fashion to manage gravity, a force that's so fundamental that we rarely even think about it. And yet it was here long before we were here, and it'll be here long after we're gone. And when you look at the body, it's pretty incredible to see how one of the things that it does is keep us upright, moving and not falling down. So that's kind of the introduction to this idea.
Yeah, I think this is fascinating. And I relate to some of your patients' anecdotal stories that they told you. I feel the same, especially flying in a plane or on roller coasters. You're just completely out of sorts. So what specifically were the findings that you came up with in your hypothesis? Like what are the key takeaways?
Right. So yeah, you just mentioned a few examples because also I've been hearing from patients for many years. They say, boy, it's weird. When I go up into the mountains, some say I feel so much better, but when I come back down, I feel worse. And I've always thought, it must just be because it's beautiful and there's forests up there, but maybe it's something about altitude, which itself is a gravity related phenomenon. So the density of oxygen, for example, is completely indirectly related to oxygen. Some people get up in high altitude and they're up too high. They get up in an airplane, they get jet belly. What's going on there? Astronauts, by the way, get GI issues. So that shows that we might need some gravity, but maybe too much is not good. Too little is not good. There's like a Goldilocks zone, and we each evolved a little bit differently. And so in the paper, I go through some details about this, starting with the gut and just starting with the way it's physically and anatomically put together. If you think about your intestinal system and everything in your belly, I think of it like a sack of potatoes that we're destined to carry around our entire life, right? So we have to carry this thing around. And some of us are sort of better able to hoist that load and keep it suspended than others. And the intestines are not like a tube that's haphazardly spooled in the bottom of a sack. It's very elegantly arrayed, like a functional stack, almost suspended like a marionette on strings. And it turns out we have a suspension system inside of our belly. It's called the mesentery. And the mesentery is a set of tissue, connective tissues, and there's ligaments and tendons in there as well that really sort of pull up the system so it doesn't fall down into our belly. Plus, that system tethers together almost like a parachute right at about the lumbar spine level. So you can imagine your spine, one of the things it's doing is pulling back on those intestinal contents to keep it from falling down. And you can imagine that might start to explain why so many people with IBS have lower back pain. Part of what might be going on is just the physical effort to carry the load of viscera. And so some people with, let's say, Ehlers-Danlos syndrome, which is a condition that often presents with IBS, they have very stretchy tissues, connective tissues. And so if the suspension systems are really stretchy, then the intestinal system falls down. And we've seen that. We could see that on CT scan of people with Ehlers-Danlos. And what happens then is it almost kinks the system. It's like a garden hose. If it's kinked, the water won't go through well and things back up. And if we're talking about the intestines, that can lead to bacterial overgrowth, gas formation, and a whole bunch of other things I talk about in the paper.
I wonder if posture is related to all of this.
Yeah, I mean, well, we do know that one of the most effective treatments for IBS is exercise. And in particular, working out your core, your abdomen, your anti-gravity extensor muscles along the spine, which is like a chassis that holds up your entire body against gravity. Tai Chi can be very helpful. Some people also do yoga positions where they stand on their shoulders and they feel like that helps alleviate their symptoms, or use tilt tables. And so strength training in general is one way to kind of fight gravity. So we can't find a new planet, at least not yet, but we can change our relationship to this planet by strengthening and fortifying our body to give us the best chance possible to kind of fight gravity. And weight loss is another part of this, is visceral adiposity. When fat accumulates inside the belly as opposed to under the skin, it can really almost cake up that suspension system and make it harder and heavier to hoist up. So these are things to think about.
So interesting. So how does this new insight impact our current understanding of IBS? I know you had stated that it could either help us understand what's already out there or maybe challenge some of the current thinking.
Yeah, and I will say that I've been careful to point out, first of all, this is a kind of a hypothesis, right? And there are ways to test it. We could talk about that. It's also not designed to undermine the existing theories. It's really a way to try and weave them all together into one unifying understanding. Because if you go through the different theories of IBS, one of them is bacterial overgrowth. Well, that's true. There's no question that the microbiome is abnormal in many people, but the question is why? Why? Well, then the answer is, well, if the intestines don't move well, or they're kinked, or they're distended, or there's dysmotility, or there's pressure, then you get bacterial overgrowth very quickly. Well, what causes that? Well, if there's a change in the abdominal cavity, its actual functional status, its anatomical orientation, then you start thinking, well, why would that happen? Well, if you have a bad back, you have a diaphragm that doesn't work, you have a stretchy mesentery, all of these things will lead to gravity pulling abnormally on. So that's my attempt to explain the bacterial overgrowth part.
It's so interesting. It's a combination of things that happen if gravity is impacting the structure of your body, the structure of your gut.
Yeah, but then there's also the nervous system itself and our neuropsychology, because our brain and our nervous system also evolved on this planet. It's not just only about the physical part. So in the paper, I talk about sort of three different components. One, I talk about what I call G-force resistance, and it kind of forms a cube. So this is how well is your body structured anatomically to manage the force of gravity. And some people are more tolerant of gravity than others. So that's G-force resistance. The second part I call sort of G-force sensitivity. If the gut is pulled or stretched too far, then what happens is the nervous system will become sensitized to that pull. And so you can imagine, for example, the bacteria themselves can create serotonin, and serotonin can sensitize the nerves in the gut which then fires off into the brain where you get G-force vigilance. And what I use the term vigilance on purpose, because you mentioned earlier roller coasters. And you said, some people on a roller coaster, they're like, oh my God, like their belly fires off. They get butterflies.
Me, I hate it.
Yes. And so I've noticed a lot of people with IBS really struggle with roller coasters. And so that got me thinking, what is it about a roller coaster? In fact, what is it about falling down on a roller coaster? It's not necessarily going up. It's really the fall where the intestines are kind of suspended for a moment. And some people love that. They throw up their hands, they're laughing, and other people are gritting their teeth and just trying to get through the drop until it's over.
Yes. And people make fun of you, right? If you're with your friends or your family, they think you're a big chicken. It's not like you're afraid of the roller coaster. It's that awful feeling in your stomach that you feel like everything's just going to fall out of you.
Yeah.
It's the worst.
So I was thinking, why is that? That if you fall in an airplane or in an elevator stomach, what is it about? By the way, falling in love and a metaphorical fall also gives some people the butterflies. So there's something about falling and gravity challenges that triggers these gut feelings. And so it could well be that, when we 10,000 years ago, we didn't want to fall off cliffs. We didn't want to get knocked down. Like literally, we physically have to stand up to survive and thrive. And so getting knocked down is a negative thing. And it's almost like our gut is a G-force accelerometer, a threat detector that's telling us that we're falling dangerously or about to fall dangerously. So it kind of evolved to become an alarm system that says, hey, you're about to fall. And of course, we've evolved so much and we have such big brains that we may not literally be about to fall, but almost like psychologically falling down. And now we start getting into what does it mean to be, let's say, depressed? I mean, literally depressed. That's downward. I feel down. I can't get up. Like literally the language we use about being depressed is literally being pulled by gravity down. The word gravity comes from the root grave, serious, bad, dangerous. Whereas looking up is heavenly and positive. And now we get into sort of the psychology of the language we use. But it turns out those aren't turns of phrase. Those aren't just colloquialisms. They're actually embedded in our biology, that we believe to our core that up is good and down is bad. And we don't want to be pulled down.
This is so interesting. See why I say I call you the coolest GI I know? I mean, this is so fascinating. I love the thinking. Before we get into some of the notes that you receive from patients, what are the key takeaways here for patients? That what is important here in how we're, viewing what IBS is and the role of gravity? And I know it's a hypothesis and it doesn't mean it's going to change, anything right now, but, what can we be thinking about?
That's right. And so it is a hypothesis. Now, of course, I didn't just totally make it up. There's, over 100 references. And what's interesting as I got into this, I realized there's so much literature on this topic, but it hasn't been looked at quite like this. And even beyond that, I started to realize that it's possible that serotonin, which underlies a lot of these conditions, IBS, fibromyalgia, chronic fatigue, anxiety, depression, serotonin itself, it's possible, evolved as a gravity management substance. Like literally without it, we cannot stand up, without getting dizzy, without our blood not being able to pump against gravity, with our intestines not being able to pump against gravity. So what this all means is, sure, the treatments that we use, it doesn't necessarily change anything at this moment, but it helps, first of all, explain potentially why there's so much overlap. Ehlers-Danlos syndrome, POTS, take those, for example. Those we could now think of as gravity intolerant syndromes. Just think, what is POTS? I can't stand up without getting lightheaded and passing out.
Yeah. Can you explain what POTS is for those who may not know?
Yeah, for sure. So that stands for postural tachycardia syndrome, POTS. And it turns out one of the mysteries of IBS is that it overlaps with POTS quite a bit. Ehlers-Danlos syndrome, or EDS, which is a condition I've mentioned before here, is a condition where there's sort of abnormalities in the way collagen or connective tissue is formed in the body. And all of these conditions, Ehlers-Danlos, POTS, and IBS, tend to overlap. And it's like, well, why is that? Well, it turns out all three of them, in my view, are problems with managing gravity. And they all have in common problems with serotonin. They also have in common abnormalities in the brain and the way the brain fires off when it is threatened. And that gets to the whole roller coaster thing. And so there's, of course, a little hand waving here, which is why we need to do research. But the implications, for starters, are just to help explain, if nothing else, but also it gives us a new understanding, as I see it, for like, what is the role of exercise? In the past, you just say, oh, go exercise, is good for you. Well, what do you mean it's good for me? I mean, we all know it's good, but what does that have to do with my gut? Well, it turns out a lot. It has a lot to do. And in the paper, I break down exactly, if you look at the picture of the body, the intestines are right up there against the spine. They're right next to each other. And if that spine is bending one way or the other, or you have some curvature, the intestines bend with it, things happen. This helps explain when I show this picture to my patients, like, this is why I want you to exercise. You have to fight gravity. We all have to. What is lower back pain if not gravity failure? What is dizziness? I can't stand up and stay up because my relationship to gravity is challenged. Lightheadedness, dizziness, tachycardia, a rapid heart rate, very common symptoms in IBS. All of them are issues with gravity management. And so this tells us why we need to work our ass off to lose as much weight as we can, easier said than done, to fight back with strengthening your body, your abdomen, your core, your back. That alone goes a long, long way. I'm not saying it's going to fix it for everybody at all. Right. We still do all the other things we've been doing. We can use antibiotics, change diet, change serotonin levels. But my sense is all of that is helping us manage life on this planet.
So, I have to ask you this next question because you're such a forward thinker, visionary in the area of virtual reality. How do you see research in this area evolving? Do you think that virtual reality can be used to train the gut to lessen the effect of gravity?
Yes. Yes, I do, actually. And we're actually working on that right now. So first of all, VR, of course, is a whole other topic, and one I'm passionate about. But we are creating IBS VR right now. We've tested it out, actually published a paper on it, and we hope to make it widely available next year on the Oculus headset. It's our goal. Hopefully I can come back in the future when that's out and talk about that.
Yes, I think it's so fascinating. And I know this is a little off topic, but what are you doing in the area of virtual reality for IBS? And can patients get access to any of it right now?
Yeah, so it does relate to the gravity part for a second. And I'll talk about how you can get access to it. But the way I think about this is, listen, some people may have inherited a body that's sort of slightly better or more challenged at managing like the forces of gravity on this earth. And you can change your relationship to gravity, even though we can't change gravity. And again, this sounds a little bit nuts. And I put out a whole bunch of examples of how to test it in the paper itself, different experiments that we can do. But my sense is that one thing that happens is we can do our best to fix the body, but we can't always do that. But you can always change the way your brain experiences that body. That's the amazing thing, is we have neuroplasticity, which means our brain is not like a block of Play-Doh rattling around in our skull. It is a shape-shifting organ, like any other organ in our body. It can change its form, it could change its function, and we can learn. And that's what learning is. We're literally changing our brain. So you think about cognitive behavioral therapy, CBT, for example, which psychologists will often do. We know it's very effective in IBS. And it's not that it necessarily is changing the gut directly, but it's changing the way the brain experiences the gut. And that's what VR is doing too. And so we've created a whole virtual clinic where we use VR over an 8-week period specifically for IBS patients to help experience their body in a different way. But we're also looking to add an anti-gravity room. That's what I'm calling it.
I knew it. I knew you were. Yeah. That's why I asked you that.
So it has rooms. It's literally like a clinic.
That's so cool.
Unlock. And the anti-gravity room, the idea is going to be in VR, there are certain exercises that patients swear by, and we're going to start experimenting with. But basically, these core workouts, you can learn to do it in VR. Plus, there's even the opportunity to use a biosensor to listen to the abdominal activity with microphones and use that to feed data back into the headset. So you can get biofeedback in different physical positions to see how it's affecting your gut. That's and so cool. These are things we're moving towards with VR.
That is it's so interesting because imagine a patient who, they feel that awful feeling when they're on an airplane or in a roller coaster. And if they can do it in virtual reality, they know that they're safe. They're not going to fall out of the airplane or fall off the roller coaster because you have that whole fear thing kicking in. So it would be interesting to see going through that exercise and training your mind or gut to whatever, feel that and know that you'll be okay, if that really changes your experience with IBS, that's very interesting. I don't think it's crazy.
For example, we have one scene right now in the current program where you could, let's say, go into a public restroom and you find yourself in VR sitting in a stall in a public restroom. And you can see people are waiting for you. You can hear toilets flushing. And you've been told that you're kind of late for an event or a meeting. And that's a stressful thing for anybody. But if you have IBS, it may be particularly stressful to, let's say you have constipation, you're straining, or the opposite. And so we actually put people in the bathroom and then we freeze and we go through an exercise, a CBT exercise on the back of the door. In the stall that you're sitting in, we use the back of the door as a CBT pad to do exercises right there in the bathroom.
Oh, wow. That's so interesting.
Yeah. So in VR, you can do this kind of stuff. Or maybe you're on an airplane. We have one like that too. Or you're eating dinner with friends in a restaurant you're not familiar with, and you're like trapped in there and you can't get out. You have to go to the bathroom.
Oh, that's so good. It's so interesting. Do you know, and this is kind of a weird question, but that fight or flight, is that more sensitive in people with IBS who may experience that sensitive to the gravity too?
Yeah, and these are the kinds of experiments worth doing, but it is known that the autonomic nervous system, so that's sort of like, it sounds sort of the automatic part of our nervous system that does manage fight or flight, is more sensitive on average in people with IBS versus other people. And so, yes, the fight or flight reaction, which is a complicated one, is definitely amped up in many people. And when people look at the MRI scan, the brain of people with IBS, you can see the emotion centers lighting up, like the amygdala, for example, in fight or flight situations at a very high rate in IBS.
Dr. Spiegel, not only is your hypothesis about the gravity, but just our conversation here today, I think for me as a patient with IBS who experiences many of these feelings, panic, the flight or fight, being on planes, it makes us feel, I'm going to talk collectively, patients, that there's hope and that we're not crazy, that there are really specific validated reasons for feeling the way we feel. It's just not all in our head. We're not, overly fearful. Like people always joke, oh, you're afraid, you're a big baby. No, it's really not. We do have serious and maybe ultra sensitive systems that really feel these things, and everything sort of kind of kicks in.
And you can see how that would have been really good to have, let's say 10,000 years ago, where, you hear a lion roar off in the distance.
You're like,
there's a reason why people have sensitive guts, because you know what? Those people were running away. Like, let's get out of here. And where the people that were eaten were the ones that didn't have the sensitive gut. Okay?
So I would have been a great cave
We're
person.
all here because our ancestors survived. And it's no wonder that 10% of the planet has IBS. This made a lot of sense. But at the same time, we're not perfectly designed creatures. Evolution is an ongoing phenomena. And the fact is, we stood up rather late in our evolutionary history. We were four-legged creatures. And then all of a sudden, we moved all of our not all of a sudden, of course. It took a long time. But we moved up.
Exactly.
And all the body systems had to change their orientation. And we've been evolving slowly and steadily to handle. And it's amazing we do it as well as we do. But, it's not too surprising that we haven't exactly perfected our body's experience of life on Earth. And on the margins, there's going to be some issues.
Well, interesting, when I experienced my worst panic was after 9/11. I was living in DC, and one of the coping mechanisms I would go to was just to be down on the floor and on all fours. So maybe that there's something to be said about feeling grounded. And maybe, I don't know if that has something to do with it, but that was one of my ways to kind of deal with it until I understood what was happening.
There's also a certain kind of vulnerability in a way. Like if, when people literally feel down and you can't get out of bed, I can't will my body to stand up and fight. And that's another way of thinking about the nature of depression. And we talked about that earlier. And it is serotonin related. It's like I'm having a gravity management problem, not just physically, but also neuropsychologically. And that's another important idea here is people with IBS, I feel the frustration because there's so many debates in our field about what causes it. Some people, oh, it's all in the brain. Oh, it's all in the gut. You know what? It's both. And it turns out this idea that the mind and the body are like separate and distinct is not right. That goes back to the mid 1600s when René Descartes, French philosopher, said there was something called dualism where the mind and the body are separate and distinct. Well, it turns out it's one continuous system. All the stuff in your belly, the nerves, the serotonin, neuroendocrine, immune system, that is your brain. It's just the part of your brain that's not locked up in the skull. It's all one system. And so what I'm saying here is the whole system is managing gravity at once, which is why all these different theories make sense. Neuropsychological, microbiome, serotonergic, nervous system, they're all working together towards the same goal, which is to not fall down. And thought this way, IBS is like a neurovisceral fear of falling.
I love it. I love it. So what are the diagnostic and therapeutic implications of this new hypothesis? It's so exciting.
Yeah, right. Well, that's a great question. So, diagnostically, there's so much work to be done. Just going back to the physical anatomy stuff, we don't really even know if we look at CT scans, let's say, of people with IBS versus controls, lying down and standing up. Just starting with that, are there differences in the way the gut lays out physically? Are there differences in the mesentery suspension systems? Are there differences in the diaphragm and how it's literally constructed and the insertion points on the rib cage and on the spine? Like just physical stuff like that. I've never seen any research of any kind, and I could be wrong, but I have not seen research like that. And that's just a simple place to start. So that's diagnostically, that may be useful. What about sensitivity to tilting the tables, right? Or moving up and sitting down? Are there differences in heart rate or blood pressure in people with IBS compared to controls? Some of that work's been done, and there is evidence that there's problems or more difficulty managing blood pressure at different positions. What about going up into the mountains versus sea level, or scuba diving versus sea level, or different latitudes along the globe where G forces do vary slightly? Something like inflammatory bowel disease, which is a different condition, it's been shown that immune system in those patients changes at the top of a mountain versus the bottom of a mountain. So none of that really has been done with IBS. And the list goes on and on. So I have a pretty extensive list of ideas in the paper of ways to think about this. Yeah.
That's so cool. So is there anything else we missed? Any additional thoughts about this hypothesis? What do you see coming down the pipeline for patients?
Well, we covered a lot of ground today, and, the paper's there if folks want to read it. But I think, I want to do more work on this. It's sort of, I threw it out there for people to chew on, think about. And it may be that parts of this are right. It may be that none of it is right. This is the nature of science, is that we put out new ideas and let creative people try to think about them, explore them, study them. So I'd love to see more research hopefully evolve from this. We intend to start pretty simply, just doing surveys. Is it true what we're saying that people with IBS are more fearful of roller coasters? That alone, I don't think has ever been shown. What does that mean about the nature of IBS, right? So I have a lot of different ideas for research, hoping others can help us out and feel inspired by the paper enough to explore part of it and see if any of this makes sense.
Well, you've gotten such a great response.
And that was my last point is, the patients who have reached out. And I think you mentioned that. I put a little tweet together summarizing some of the ideas that people came to me with. And they're so interesting how people have said, you know what? Yeah, this sounded kind of wild, but it really is consistent with my lived experience. When I do yoga on my head, I feel better, but not other positions. Or when I scuba dive, the pressure from the water actually helps kind of like keep me together and I feel better, not worse. But then I feel worse when I get up, or I feel better at the top of a mountain, or I feel better or worse in an airplane, or I do use tilt tables, and the list kind of goes on and on. Every one of those is an anecdote, so it doesn't prove anything. But we can at least use that as a blueprint to start thinking about treatment. Maybe we should try tilt table therapy for IBS. I don't know. Maybe we should try certain yoga positions for IBS. All possibilities.
I think it makes so much sense, and we'll be happy to help get patients to, participate in surveys if you need to, because I think this resonates with a lot of people from just the feedback that I've seen online with social media and just generated from your paper. This is great. I look forward to seeing more stuff from your research, and, keep us in mind if you ever want to speak again on a topic that it's not crazy. We like crazy things. We like different, and we like visionary. And I think this is what's really going to push patient care forward and our understanding beyond just what's already known. So you do such great work.
I appreciate that very much. And I have to say, this paper, I would not have written it earlier in my career. First of all, because I wouldn't have thought of it. I think it took me just years and years of experience of hearing from patients to think of it. But even if I had thought of it, honestly, I would not have had the courage to write it up. I would have just been too afraid of people thinking I went off the deep end. And I still have, but at least I have more courage now to and I think I would love to see other people be comfortable putting out ideas that are evidence-based, scientific, but testable, and not to overstate it. This isn't snake oil. This is just a set of ideas. And I've been really gratified that people haven't thought I went totally nuts. Maybe a few people did.
No, but you're a pioneer, and, it's not always an easy path, but it breaks ground and it gets people thinking. And as a patient, I can say it resonated with me when we spoke about it in Charlotte. I was like, oh my God, this makes so much sense. And then you've seen it yourself with the feedback you've gotten from patients. So I, as a patient and an advocate, really appreciate the work that you're doing, and really appreciate your being on our podcast episode today. And I look forward to seeing more things coming down the pipe. Oh, virtual reality. How can patients access any of those programs? Oh,
yeah. So right now, the VR is only in research studies. We are going to announce some studies that are going to begin next year. So you can check our website. It's called virtualmedicine.org. Great. And on there, we make announcements for new studies. We have a little area on there for our studies. But we do, as I said, intend to actually launch it to the public next calendar year.
That's wonderful.
We'll be making announcements about that. We really are working very hard to get it out so people can actually start, trying it out and testing it.
No, this is great stuff.
Well, thanks for your interest. Appreciate it.
Thank you so much.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.